The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Brian's jaw surgery and George's struggle with kidney failure. 4 years ago, 17-year-old Brian was a passenger in a car that was hit by a train. He has already endured 4 surgeries and has paralysis on the right side of his face. Now Brian and his parents have traveled from Winnipeg for surgery to rebuild his jaw. Doctors hope to make Brian's face more symmetrical and improve his bite so he can eat normally.
I'll just go over this, what we're going to do and where we're starting. This basically is the way he bites now.
Sure.
Teeth fit like this. Obviously, it's not the way things are supposed to be. We want to give him a real good bite and a really good occlusion. And if you take a look at this, the model surgery's been done. What we do, we actually cut these models off the plaster. We set them up so they fit exactly the way they're supposed to be, to position the jaws in the ideal position. That way, it's not sort of guessing. We've got some positive places to position. So when treatment's complete, we should end up with the teeth functioning in this position, which is an ideal front to back position and an ideal position with respect to the biting surface, and get a very nice aesthetic result. So that's where we're aiming for.
But doesn't it look wonderful? Doesn't it?
Yeah.
That's why when I seen it, I started crying.
I know.
9-year-old George is suffering from a blocked kidney, the result of scarring from a previous surgery. Urine collects in his kidney, causing it to become enlarged and prone to infection. His condition is painful and can result in kidney failure. Today, doctors will try to clear the blockage without making an incision in his body using a laparoscope.
Did you bring anything special with you today, Teddy? No? You don't have a lucky thing you take in the operating room?
If they are not successful, George may have to face a major surgery to save his kidney function.
You guys can have a seat in the playroom while I get the other family ready.
I don't come down.
I can only go up as far as the
No,
door.
I mean like when I wake up.
Yes, I'll be in the recovery room. Okay? It's okay. You'll be fine. And then you can ask Dr. Curry the question. Okay?
All right. Nice to see you.
Good to see you.
Anything new and exciting to report?
Nothing much. We went to see Royal Canadian Air Force when we were down here.
Was it good?
Oh, it was great. We got front row seats.
Show me your teeth. Close. It's gonna be a great change for you.
I know. I've been waiting for this. I've gone through a lot.
Oh, sure. So tomorrow, for the upper jaw, what I actually do is make a cut right off in the sulcus.
Okay.
And because it's 2-part, I'll actually make an incision in the gum between where those 2 pieces are. And then once I've mobilized the upper jaw, I actually bring you forward, bring the 2 segments together, and then I wire you up in the splint. Whether or not I leave you wired together at the end of the case depends on what the fixation is like, how solid it is. But the thing to remember, especially with the tube in your nose, is if you wake up and all of a sudden to think, you know what, I may have my teeth wired together and the breathing tube may still be in. So it's always best to tell you that, because then you won't panic when you wake up.
How are you, big guy? Things all right? How are you, Mom?
How are you?
Very good. Are you doing okay?
I'm okay.
Good. So, do you know what we're going to do today? Don't. Okay. I'll make you a little drawing. You know, this is your kidney. And then we have a ureter, a tube that takes the urine down all the way to the bladder. And right here, where the ureter joins the kidney, there's a band of scar that's made this junction here narrow. So what we're going to do today is when you're asleep, we're going to go up with a little scope that has a camera at the end. Look at this point here and make the scar wider. Cut the scar so that it goes from being narrow like that to being wide like that. Hopefully this will relieve the obstruction so that the pee comes out of the kidney easier. At the end of this, we have to leave a stent so that it heals around it. Okay? You've had a stent before, and the stent goes from the kidney down the ureter and sits in the bladder, and it will drain all the urine away for you. All right, big guy? Okay. Are you nervous? You are? I'm nervous too.
You better not be.
So you're gonna hold my hand or what? Huh? You set to go? Let's go. Okay. First, we're going to take a look inside the bladder, Stefan, and to outline the area, the exact location of the obstruction, and how long the obstructive segment is. And we're going to do all this procedure today without any incisions, so that we can hopefully save him another operation. There's the kidney. And that's the narrow spot right in there that doesn't distend to open up. And what we're going to do is go up there with a special scope that goes up into the ureter and then incise with an electric current that will allow us to open it up and put another stent in. The ureters in children are quite fragile, and if we're not very careful, we can put a hole in the ureter, which is very damaging. Very careful here.
Okay. I said, yeah,
All right.
You planning on wearing that in surgery?
Yeah.
Your little Armani set there?
You like it?
I like it, yeah.
Basically, this is the splint I told you is going to be left wired to your upper teeth. Okay, so when you wake up, even if you're not wired together, this is going to be wired in place. And the reason for that is it stabilizes these two segments in the proper position until they're healed. Okay.
Yeah.
And then the only other thing to remind you, it's possible, I hope it's unlikely, that you'll wake up and then you'll be wired together like that.
Okay.
And the only other thing that could happen is if it looked like at day 5 or 6 you weren't popping perfect into the splint.
Okay.
That's when we make another decision whether we'd wire you up for a couple of weeks. Okay.
Yeah.
I'll take good care of him, I promise.
Yeah, it's gonna be beneficial. I mean, like, I've had all the surgeries I've had have been beneficial. So,
But this
I
one,
mean, I know this one's good. I know. I mean, all my teeth.
and
I can
corn
eat.
in the
I
cob.
can eat again, like properly.
Yeah.
Exactly. I love you too.
Love you, bud.
Yep. I know. I know. I'll be okay. Okay, I'll see you when you wake up, okay? Okay.
Okay, so wires in. So we're going to do this with an electric current, a cutting current, and we'll use a catheter that has a wire that runs right in it. So the catheter acts as the insulator for the wire. We take the light and the water from this guy. And we switch scopes. Let me see, pull back, let me see what's happening on the medial side first. Come out very slowly. I would go another little tiny fragment right there. Right there. Okay, let's incise this part too. You ready? So we're backing out of the ureter again. And now we're going to put another stent so that that incision heals around it. And our hope is that this will heal without recurrent scar, because of course if he forms scar again as he heals, that's not going to allow it to remain open. What we did is we went up the ureter. The narrow segment was about a centimeter long, very short. So we came in with our electrocautery and basically incised this flap here.
So now the opening has widened then?
Yeah, it's much wider. He has a stent back in because we need to keep it open while it heals so that hopefully it doesn't stricture back down again.
Take this on. Take this on. You can hold this. You see those fiber attachments right here? That's the temporalis attachment to the corner. Strip it off. So I try to stay above to start my cut. So all that soft tissue coming in below there. Where you see the fat?
Yeah, you see that?
That's where the nerve's going to enter, right there. You try to stay above the nerve, and actually you can see the nerve now. You see it?
George, hi honey. How are you feeling? Not good? I know. It's sore, it's swollen.
We were a little concerned. His urine is really quite red still, so we're just on the phone talking to Dr. Curry and seeing what he's going to decide on that. It's pretty red, and there's been some clots in it and stuff, so it hasn't really changed a lot in its color since he got here, and I think they were sort of hoping with all the fluid it would dilute it.
You know what, we'll keep on running the IV fast, and if it continues to be that red, we'll see how things go. But he did have some blood clots in the kidney pelvis when we were done.
So this tells us where our maxilla should go relative to where our mandible is now. You can see already that his midface is come forward from pre-op, but we've moved his maxilla, his upper jaw forward. So instead of looking flattened through here, he's got more central mid-face projection. We actually check and see if he's going perfectly into his splint, and he is. So there's no need to wire him up today. Hi. All right, he's fine. Yeah, no problem.
No problem.
The mandible split went absolutely perfectly. The biggest risk that we had talked about with that was the nerve, the sensation. We saw both nerves, and the nerves should be intact, so I don't see that as a problem. So we didn't have to leave him wired up. The little plastic splint is just wired to his upper teeth, and that'll stay on there for about 6 weeks. And the reason for that, what it's doing is stabilizing those two segments in position so that they can heal in that position. And you can relax. Give the ladies about 15-20 minutes, and you'll be able to go and say hi.
Okay. Thanks.
He had a good night, so he's gonna eat a bit this morning. And now the catheter is draining clear pee. So we'll remove the IV, and he will be ready to go home today. What do you think about that? Is that a good plan?
Okay, thanks a lot. Thanks, everyone. Bye.
Bye, George.
Hi, I took off, I took what's up. And hi, Dad. Hi, Russ. How are you doing?
We're okay.
Good.
Everything went better than Dr. Phillips' plan.
Good.
Everything went wonderful.
He's got my hand.
He's not letting go.
I will stay here. I won't leave. okay? As long as they let me stay.
Hey, people.
Hi.
What do I get the brace out?
The splint, that plastic
Yeah.
splint, 6 weeks.
Whoa.
Yeah, what it's doing is, remember how
Just a question.
Yeah.
Is that what is inhibiting our ability to talk properly?
Yeah, plus you're swollen. I mean,
When the swelling goes down, I'll talk properly?
Yeah.
Okay, that's
Yeah.
all I want to know.
Yeah, but what'll happen today still is you're gonna puff up more.
Yeah.
And you'll maximize swelling probably tonight. And then hopefully Sunday, Monday, the swelling will start to go down. Okay, I'll see you tomorrow morning.
Okay.
Hang in there.
Yeah. Okay, take care.
You sleep. Tell that you're tired.
Yeah. I'm very tired.
Dr. Michelle Gordon. Dr. Michelle Gordon.
Let it go. Take a big breath in and hold it in for me. Hold it nice and tight. Good job. Breathe.
Good looking milk there. What do you think you'd like to start with?
Well, milk.
It'll be all right. I know you haven't had this kind for a while.
Uh-huh.
Yeah, because we usually have 1%. But they suggested this because they want you to have some of this fat, just so that you don't lose any more weight than what you
Oh
have.
gosh, that's really thick.
Yeah?
Yeah.
I know, you're just not used to it, but I'll just give you a little bit to start. You tell me if it tastes too hot, okay? It won't burn you.
It's good.
It's good?
Yeah.
Good for go?
Yeah. Okay.
Okay.
Put your teeth together.
I did it.
Go ahead, put your teeth together. Slide a bit. Yeah, there you are. Can you feel the difference when you're going right into the swing? That's perfect right now.
I was looking, like, I was just feeling it on my teeth, and I was like, oh, it's like perfect fit. There's the door. I was like, oh man.
Yeah.
It's like,
Can you feel how it interdigitates? It goes right into the splint?
Yeah,
that tells you you're
totally.
perfect.
It's awesome.
Okay, so you know you're going home today?
Yes.
Awesome.
Yeah.
Okay.
Yeah, you're all right.
Oh yeah.
You sure?
Yeah.
Okay. Just remember, Brian?
Yeah.
Slow.
Yeah.
Hey, how are you guys doing? Good. So, Mr. George, you had your ultrasound and your scan, right? The last ultrasound that I have for you, without a stent, shows, and I'll put it up here and we can take a look at it. This is the kidney. All this black stuff is urine that was not able to drain from the kidney. And at that time, our numbers were around 3.5 centimeters. And on today's ultrasound, on the most recent one, we're down to about 1.5 centimeters. Has he been having any pain or symptoms?
George? No, nothing at all.
He's fine, huh? Yeah. Pain will be the key thing. If this obstructs again, the first thing you'll notice is you'll start having pain in your side. Okay? So if you start, if one side feels different than the other, or if you start having pain or anything at all, then you should let me know.
Okay.
Okay?
Oh, that's good.
Good man. Give me 5. All right. Excellent.
Now that George's kidney is functioning better, he is no longer experiencing pain.
Yeah!
Doctors will continue to monitor him over the next year, but are hopeful that George will not have to face major surgery.
this guy looks quite a bit different, doesn't he?
Bite down for me.
So Brian, this is healed very well. Things are in the exact position we put them in at the time of surgery. So from our standpoint, we're very, very happy with what's happened so far. For our purposes, I think things are pretty well complete.
Thank you very much.
Great.
Brian's jaw surgery has been a complete success.
There you go, Brian.
His bite is normal and his appearance is improved.
I want to see you bite into this. Is it good?
Brian plans to undergo additional dental surgery, but he is one step closer to repairing the damage he endured in the accident 4 years ago. On the next episode of Life's Little Miracles, Aaron's spine surgery.